what is the definition and principle of host defense in human body, how the innate and adaptive immune responses play their role in order to protect the human body from invaders, and what is the mechanism of a specific host defense. So let's begin our session with the definition of host defense. Students, it's a complex interacting system that protects the host from pathogenic invaders, whether they are exogenous or endogenous. Exogenous means that those pathogens which are present in our environment and they get access into the body by different means. And endogenous pathogens, or you can say that endogenous microorganisms, are those that which are present normally in our body in the form of normal flora, and once they become opportunistic flora when the conditions become altered. This system includes physical and chemical barriers, inflammatory responses, the reticuloendothelial system, and different type of immune proteins and molecules. Now, let's see that what are the components of host defense. Students, basically we have two important components of host defense. One is the innate immune defense and the second is adaptive immune defense. You must have understand the concept of innate immune defense in the previous lecture of immunology. So we will be discussing the overview of entire innate immune response concept. Okay, when we are talking about bacteria, students, when we say that what are the different type of bacteria, so on the basis of immunological response, we can categorize the two types of host defense against these bacteria. One is the pyogenic response and the second one is the granulomatous response. The granulomatous response is seen against those pathogens which are intracellular. It means the type of bacteria which can invade the cell and reside and survive over there. For example, Mycobacterium tuberculosis. This is a type of bacteria which get access inside the cell and reside in the cell for several hours, for several weeks, and for even several months to years. In this case, the body evokes the granulomatous response, in which the macrophages play their part and CD4 positive T cells play their part, and overall response will be in the form of a granuloma formation. Second category of organisms are extracellular pathogens, means those organisms which do not invade the cell and they remain outside of the cell. They are called extracellular pathogen. For example, Staphylococcus aureus, Streptococcus pyogenes, Haemophilus influenzae, and they are protected against by the pus producing response, means the pus will be formed, therefore this is known as the pyogenic response. And this consists of antibody formation, the involvement of the complement systems, and the actions of neutrophils. Now let's begin with the innate immune defense. Students, this is the inbuilt immune defense of human body, means everybody has this innate immune defense already programmed in our cells, and this exists even before the infection and responds rapidly to the microbes, because this is preformed and it is fully active, but the disadvantage is that this is non-specific. It also relies on the body's ability to recognize the conserved features of the pathogens that are not present in the uninfected host. Innate immune defense comprises of physical barriers, the phagocytic cells, and the plasma proteins. Let's discuss the physical barriers. The most important line of defense in our body, or I would say that the first line of defense in the body, is the skin and the mucous membranes. Then comes the role of tears, the acidic pH in different parts of the human body, and several surface clearing mechanisms like sweating, like blinking. These are all included in the physical barriers and are the part of innate immune response. Now let's begin with the skin. Students, the intact skin is the first line of defense. You know that whenever we get breach on the skin, a cut on the skin, or any abrasion on the skin, there is a potential chance of getting infection, because now the skin is no more intact. Now the microorganism can get easy access into the body via that intact skin. Also, the skin has sweat and sebaceous glands. These glands are producing sebum, and sebum is has a very protective role against not only bacteria but also against different type of fungal species, because the sebum is constituted of fatty acids, and these fatty acids keep the pH low. Means the skin pH is kept at low, about 3 to 5, and this low pH is also responsible for killing of microorganism. Secondly, these fatty acids itself, they have antibacterial and antifungal activity. Therefore, the tinea infections, the ringworm infections, are more commonly seen in childhood as compared to in adolescents and in adults. Because what happens that when a child hits the puberty or reaches the age of puberty, the sebaceous gland starts producing more sebum under the action of androgens, and due to which the sebum's production is increased, and this sebum has, as I have told you, that they have protective fatty acids and they protect the body against the fungal infections as well as the bacterial infection. So this is a very important role of secretions of sebaceous glands. The mucous membrane, it has also a very important role in our body, and you can say that this is a second important defense. And if we talk about the respiratory tract, we know that the respiratory tract is lined with the cilia and it is covered with the mucus. So whenever there is a movement of the cilia, it will pull out the mucus up to the nose and the mouth, and this mucociliary apparatus, means mucus along with the cilia, they have the capacity to trap the bacteria, and this mucociliary apparatus is also known as the ciliary elevator, and it has a very important role. And this ciliary elevator gets you can say that destroyed by the use of alcohol, by the use of smoking, cigarette smokes, and several viruses. Also in respiratory tract we have very important function of alveolar macrophages. We have lysozymes, and important thing is the hair in the nose. The hair in the nose, they also trap the dust particles and big size particles to get access into the body. So overall, the function of mucous membrane is protective, and they protect against several type of invaders. Okay, the acidic pH. This has also a very important role. Students, the acidic pH of stomach, you know, that has an ability to kill the bacteria. The normal pH of stomach is between 2 to 3, and this is because of the production of the acid. So, for example, if we have engulfed something which is detrimental, which is pathogenic, what will happen that this acidic pH of stomach will kill that at their place. Also, we have the acidic pH of vagina. You know that in a reproductive age, the sexually transmitted infections are very common. And what happens that when the lady reaches to the age of menopause, mean around 45, 48, or 50, whatever the age of menopause is, there is an alteration into the normal flora of the vagina. In reproductive age, the normal flora is lactobacilli. The lactobacilli produces lactic acid, which keeps the vaginal pH low, and this protects from the sexually transmitted infections. But what happens that after the menopause, there is a changes in the estrogen level. Now the lactobacilli, they start declining, and instead of lactobacilli protective mechanism, the opportunistic infections become active, like candidiasis, vaginal candidiasis, and therefore postmenopausal women present vaginal candidiasis more frequently as compared to the females of the reproductive age. So the acidic pH of vagina protects from yeast infections, anaerobes, and gram-negative bacteria. Also, in GIT tract, we have, and lower respiratory tract, we have special important cationic peptides which are known as the defensins. These defensins have an important action that they create pores in the membranes of the bacteria which kills them. For example, alpha defensins they are found in the neutrophils and the Paneth cells in the intestinal crypts, while in respiratory tract we can find another type of defensin which is known as the beta defensins, and overall their function is to create the pores in the membranes of the bacteria, so that once the pores are created in the membranes of the bacteria, what happens that all the constituents of the bacteria they ooze out, and eventually a bacterium dies. Okay, so this is the picture which is taken from the Warren Levinson, and this table is showing that damage to the skin and mucous membrane, how it predisposes to infection by certain bacteria. Uh, Intravenous catheters, obviously the site of infection is the skin. Whenever the intravenous catheter is placed in the skin, the most commonly seen infections along with the intravenous catheters are Staphylococcus epidermidis and Staphylococcus aureus. In diabetics, skin infections are also very common. We are going to discuss that why these are common, and most commonly seen pathogen is Staphylococcus aureus. Pseudomonas aeruginosa causes infections in burns, the patients which have gone under severe burns, and also a condition in which is called cystic fibrosis. Cystic fibrosis is a condition in which there is a mutation in CFTR gene, as a result of which very thick and copious amount of mucus is produced, and this mucus is that much thick that it starts causing the clotting of the small vessels and in the respiratory tract. And whenever the patient is of cystic fibrosis, the chances to get infection by Pseudomonas aeruginosa are increased, but also Burkholderia cepacia and Stenotrophomonas maltophilia infections are seen. Actinomyces israeli, they causes infection when there are trauma to the jaw, because normally they are normal flora in the gums. Infections with viridans streptococci are seen in the cases of dental extraction. Although they are not causing the local infection, means not at the site of the dental extraction, but once they get access into the bloodstream, they can causes the endocarditis. Then we have viridans streptococci. Uh, they are causing the oral mucositis, and this is seen in the patients who are undergoing the cancer chemotherapy. And viridans streptococci can not only cause infection in mouth but also into the whole GIT tract. Okay, so this is the early host response to a bacterial infection, that when a bacteria enters the skin, it can activate the complement system via alternative pathway. When it activates the complement system, what happens that C5a, which is a component of complement system, attracts the neutrophils. C3b, another protein seen in the complement system, it opsonizes the bacteria and enhances the phagocytosis. Then C5, C6, 7, C8 and C9, they form the membrane attack complex. Overall, they form a membrane attack complex, and which causes the lysis of the bacteria. Second thing is that when it enters the skin, it is phagocytosed by neutrophils and by macrophages. What happens at macrophages? One thing is that due to the phagocytosis, the cytokine production is increased, like tumor necrosis factor, which will induce the inflammation, the interleukin 1, which will cause the fever, interleukin 6, which will induce the acute phase proteins or acute phase reactants. Then several chemokines like interleukin 8, they will attract the neutrophil in macrophages. Then, or there is a possibility that the macrophage, as they, you know that they are antigen presenting cells, so they will present the part of the bacteria on their surface which is called epitopes, and they will stimulate the antibody formation and as well as cell mediated immunity. Okay, now how does the inflammatory response is evoked, and what is the process of phagocytosis? Now we are going to discuss inflammation. Students, you have read already about the inflammation, that whenever there is a foreign body, whether it's a bacteria, it's a virus, or anything which is outside of which is coming outside of the body, it will stimulate the inflammation. The signs of inflammation are heat, uh, redness, the swelling, pain, and the loss of function of that particular tissue. Uh, the heat and redness is because of the vasodilatation, and because vascular permeability is increased in the inflammation in response to the histamines, prostaglandins, and leukotrienes, which are produced from the mast cells and other cells. Also, the swelling, which is again due to the increased vascular permeability. The pain is because of the stimulation of the nociceptors and release of the bradykinin, and the loss of function, it can be due to the pain, because of the reflex muscle inhibition and other factors. So whatever the reason is, the inflammation begins. Okay. Remember one thing, students, that role of phagocytic cells is very very important in order to get rid of any invading pathogens. There are several phagocytic cells in the body, but most important of them are the neutrophils and the macrophages. The both macrophages and neutrophils, they are the part of the innate immunity, and they have the responsibility of phagocytosis. The difference is that neutrophils, they are granulocytes, and they work as phagocytes only in the circulation, while macrophages, they are agranulocyte, but they have an ability that they can phagocytosed inside the tissue. Macrophages are associated with chronic or granulomatous inflammation, and they produces pro-inflammatory cytokines. The pro-inflammatory cytokines are those mediators, inflammatory mediators, which will promote the inflammation. And important one are interleukin 1 and tumor necrosis factor. Also, the neutrophils, they are responsible for acute pyogenic infection. So the role of phagocytic cells is also very very important in innate immune response. Okay, so this is showing the process of inflammation, or you can say that inflammatory response by different type of mechanism. As I have told you that we have two type of bacterial immune response against bacteria. The one is the pyogenic response, which is again towards those pathogens which are extracellular, and then we have a granulomatous type of response, which is towards the intracellular bacteria. So in intracellular bacteria, the classical example is Mycobacterium tuberculosis. That helper T cells, the CD4 cells, they activate the macrophages under the action of interleukin 2 and gamma interferons. The activated macrophages and activated helper T cells, they cause the delayed hypersensitivity reaction, a type of reaction which will take several hours to weeks to develop, because it's a very slow and progressing reaction, and as a result of which the induration and erythema is seen, which is seen in the Mantoux test also, which is the basis of Mantoux test. In pyogenic bacteria, like for example Staphylococcus aureus, what happens that the alternate system or and classical system alternate pathway and the classical pathway of complement system are activated. This can be basically due to the bacterial antibody complexes, or because of the directly bacterial different type of bacterial proteins present on the bacterial surfaces. The complement activation system causes the attraction of the neutrophils to the site of the infection under the action of C5a, and also it mediates the release of several you can say that factors like histamine, which causes the vasodilatation, increase the capillary permeability, and this is under the influence of C3a and C5a. So C3 and C5a are the very important constituents of complement activation. Okay, so before going to the phagocytosis, actual process of phagocytosis, I would like to tell you certain proteins which are known as the acute phase reactants or acute phase proteins, and the most important of them are C-reactive proteins, mannose binding proteins. We have lipopolysaccharide binding protein, which is also known as endotoxin binding protein. We have interleukin 6, we have gamma interferon. These are the different type of proteins which are called as acute phase response proteins or acute phase reactants, because what happens that whenever the process of inflammation triggers, they start producing from different parts of the cells and exerts their effect and promotes the process of inflammation. And also there is a very important role of polymorphonuclear neutrophils, which we are going to discuss later. So let's begin with the process of phagocytosis, which constitutes three steps. The first one is the migration, the second one is ingestion, and the third one is killing. So the first step to initiate the process of phagocytosis is the migration of polymorphonuclear neutrophils to the site of the infection. You know that polymorphonuclear neutrophils, they are the very important part of the innate immune response, and it is said that about 60% of the infection, the circulating neutrophils are PMNs. And this attraction or this migration is due to the production of several chemokines like interleukin 8 and the C5a, which is a part of the complement system. Now what happens that these migration of PMNs is start now taking place, and this is mediated by the interaction of PMNs with different type of proteins which are known as selectin. The selectin are the group of proteins which are present on the endothelium, and also there are another group of proteins which are known as the ICAM protein. These are the intracellular adhesion molecules protein. They are also found on the endothelial cell surface. So what happens during the process of phagocytosis, the production of ICAM increases, the production of selectins increases, the production of integrin increases, and overall they all facilitate the attachment of PMNs to the surface of the endothelium, means at the site of infection. Okay, now you know that, as I have told you, that due to the increment in the ICAM proteins production, there is an increased adhesion of PMNs at the site of infection. And also there is an increase in the permeability of the capillaries, and this is due to the release of several histamines, several bradykinins, and several prostaglandins, which allow the PMNs to move through the capillary wall so that they can reach the bacteria and track the bacteria. And this migration of PMNs through the capillary wall is known as the diapedesis. Okay, now the migration has taken place, the PMNs has reached the site of infection. Now comes the second part, which is known as the opsonization and phagocytosis. Students, you know that opsonization, maybe you have heard this term before, and about opsonins, that the bacteria now they will be ingested by the membrane of the PMNs in the form of a phagosome. The PMNs will form a phagosome and they will engulf the bacteria, but this engulfment will be enhanced by the addition of several opsonins. So opsonins are the specialized proteins like immunoglobulin G antibody, or they can be C3b component of the complement system. So they will help the bacteria to be engulfed, or in other words, that they opsonins will make a bacteria delicious so that it can be engulfed by the phagosome, and this process of addition of opsonins to the bacterial surface is called as opsonization. Okay, now migration has taken place, now a phagosome has formed, now the bacteria has been engulfed into the cell. Now what will happen that during the engulfment, another important metabolic pathway will be activated, and this is known as the respiratory burst. Respiratory burst is also known as the oxidative burst, and in this process what is happening, that there is a release of reactive oxygen species, superoxide anions, and hydrogen peroxide. And hydrogen peroxide and superoxides, they have ability to kill the bacteria, means they are bactericidal. So what happens that under the action of NADPH oxidase, the superoxide radicals and hydrogen peroxides are formed, which are known as the reactive oxygen intermediates. So in the first reaction, what will happen, that the molecular oxygen will be reduced by an enzyme which is known as NADPH oxidase, and it will form the superoxide radical. The superoxide radical is comparatively a weaker radical, and it is not that much strong. The actual potent radical is the hydrogen peroxide, which is very much toxic, but this hydrogen peroxide is not effective against catalase producing organisms like staphylococci. So hydrogen peroxide plays its role in the production of hypochlorite, which is again a very important molecule to destroy the bacteria. So during the oxidative burst or respiratory burst, we are having reactive oxygen intermediates. Also, we produce the nitric oxide, which is another important microbicidal agent, and it is known as a reactive nitrogen intermediate. But this enzyme has also its role in causing hypotension during a septic shock, because nitric oxide is a vasodilator, and this vasodilator causes the vasodilatation, as a result of which the hypotension occurs, and it can causes the you can say that hypotension in septic shock. Okay. So the respiratory birds also causes a production of different microbicidal agents. Among them, the nitric oxide is one, and we have superoxides, and then we have hydrogen peroxide. But what is happening, students, like in this picture, this is a very simplified picture that bacterium has attached to the membrane of a PMNs, and it is taken inside the cell, and this process of engulfment is enhanced by the opsonins, and this process is called opsonization. So actually what is happening inside the cells, what is the basic phenomena by which the bacterium is killed inside the phagosome? This is dependent upon degranulation, means the degranulation of lysosomal granules, and also the production of hypochlorite ion. So if somebody says that how a microorganism is killed inside the phagosome, your answer is that it is due to the lysosomal degranulations and production of hypochlorite ion. So students, in the cytoplasm we have two type of granules. The lysosomal granules, we have two type, the larger one which are about 15%, and they contains a very important enzyme called myeloperoxidases. And the second is smaller granules which are about 85%, and they contains another group of enzymes like proteases, nucleases, and lactoferrins and lipases. So what happens at the degranulation takes place, the lysosomal granules fuses with the phagosome and empty their contents into the phagosome. So the now what will happen, the actual killing of the microorganism will takes place, and this is done by means of oxygen dependent pathway and oxygen independent pathway. In the oxygen dependent pathway, there is a production of a very important molecule which is known as the hypochlorite, and here comes the role of myelooxidase, which is present in the larger lysosomal granules. In myeloperoxidases, what happens that they will catalyze the reaction between the chloride ion and hydrogen peroxide, as a result of which a very important molecule will form which is known as the hypochlorite. Hypochlorite is a very detrimental molecule, and it will react with hydrogen peroxide to produce singlet oxygen. The singlet oxygen itself is damaging, and it causes the breaking of the double bonds of the fatty acids of membrane lipids. So once the membrane is altered, the bacterium will eventually die. Okay, now there are certain conditions, although very rare, there is a deficiency of myeloperoxidase enzyme, in which obviously the myeloperoxidase is not there, so there the conversion of hydrogen peroxide into hypochlorite and singlet oxygen is not there. So this is a rare condition, but yes, there is possibility that those individuals will not be able to generate hypochlorite ions during the process of killing. The oxygen independent mechanism occurs whenever there is an anaerobic condition, and in this mechanism there is an involvement of the lactoferrin. Also, you know that the role of proteases and nucleases and lipases, they all will chelate, for particularly lactoferrin will chelate the iron, will take away the iron from the bacteria, and eventually the bacteria will die. Okay. Um, Now, the actual killing has been explained, that actual killing is big by the degranulation, by the production of hypochlorite ion. But now what happens at that if there is a reduced phagocytosis? means if the body is unable to perform the phagocytosis process of phagocytosis properly. So it will causes the predisposition to the several bacterial infection. There is a condition which is known as a chronic granulomatous disease. This causes the repeated infections in children because in chronic granulomatous disease there is a deficiency of enzyme NADPH oxidase, due to which the hydrogen peroxide is not formed. So even so, when there is no production of hydrogen peroxide, there will be no production of hypochlorite, there is no production of singlet oxygen. So overall, the children are more prone to get infections in their childhood. Second thing is that there is another condition which is known as the Shediac-Higashi syndrome, in which there is an abnormality in the lysosomal granules so that they do not fuse with the phagosomes and they do not empty their contents. So what happens that even if the bacteria is taken up, is ingested, it will remain viable inside the cell. Then neutropenia. This is a condition in which the PMN's count is drops below the 500 per microliter, and this is due to the immunosuppressive therapies or maybe the irradiation therapies of the cancer patients. Also, we have a condition neutropenia. We have the several conditions like candidiasis, like histoplasmosis, because what happens whenever there's a deficiency of neutrophils, the person becomes more vulnerable to catch the opportunistic infection like candida albicans infection, oral thrush, vaginal thrush, they increase. Histoplasmosis infection, which are seen especially in those individuals who are on immunosuppressive therapies. Also, you know that diabetic patients, we all have seen that diabetic patients have propensity to develop infections more common as compared to the normal individual. The reason is because of that, there are two reasons for that. One is that poor glucose control, which causes the acidosis, and acidosis in turn causes the decreased production of PMNs, as well as in the diabetes mellitus. We know that the plaque formation is very much enhanced, and this plaque causes the occlusion in the microvessels as well as macrovessels. So whenever there is a poor blood supply to that particular area, obviously it will lead to the poor supply of the immune cells, and eventually the person is more prone to develop infections. In diabetes mellitus, the most commonly seen infections are the malignant otitis externa, vaginal candidiasis, the community acquired pneumonia, skin ulcers, they are very commonly seen, tinea infections, and mucormycosis. Okay, so this table is showing the reduced phagocytosis, which predisposes to infections by certain bacteria. Like for example, if there is a decreased number of neutrophils because of the cancer therapy, because of the irradiations, what happens that Staphylococcus aureus and Pseudomonas aeruginosa infections are more commonly seen. And if there is a decreased function of neutrophils, like in chronic granulomatous disease because of the NADPH oxidase deficiency, or because in the diabetes when there is a ketoacidosis, the S aureus, the Staphylococcus aureus infections are commonly associated. And then we have another thing, which is because of the decreased function of spleen, like those individuals who have undergone the splenectomy. You know that spleen plays a very important role in immune system, because it is a part of reticuloendothelial system along with liver and bone marrow. And what happens that if there is an splenectomy, those individuals are more vulnerable to catch infections by capsulated bacteria, and the capsulated bacteria are Streptococcus pneumoniae, Neisseria meningitis, and Haemophilus influenzae, because the engulfment of capsulated bacteria is basically the role of reticuloendothelial cells. Also in sickle cell anemia, what happens that the cells, red blood cells, are sickle shaped and they cause the autoinfarction in the spleen, and eventually again the function of the spleen is deteriorated, and capsulated infections by capsulated bacteria are more commonly seen. Okay, the fever, this has a very important role. Students, you know that whenever we get infection we get fever, because the fever has a protective response, and it is due to the rise in the body temperature is because of the endogenous pyrogens. What happens at the pyrogens which are produced from the bacteria or viruses or from from other organisms, what happens that these prostaglandin E1 will cause a resetting of the thermostatic set point, which is in the hypothalamus, and the temperature raising response will be there, which causes a vasoconstriction, shivering, and piloerection and metabolism. And eventually what will happen that the core body temperature will reach a new set point, and once that set point is altered, the body will experience high temperature. And in the end, the temperature reducing response is also there, like vasodilatation and sweating and all that. But overall, the fever has a protective response because at higher temperatures, growth and the metabolism of bacterium is decreased, and somehow it is stopped. Okay, so this was all the part of the innate immune defense, in which we discussed the inflammation, we discussed phagocytic cells, we discussed phagocytosis and how the killing is happening in the phagosome. Now we are going to move to the second part of the host defense, which is the adaptive immune defense, and it is comprising of passive immunity and active immunity. Students, the passive adaptive immunity is a temporary protection against microorganism, because it is because of the preformed antibodies. For example, we give a serum to the patient which has already antibodies against that disease, or the transmission of the immunoglobulin G from the placenta, means the vertical transmission from mother to the baby, or via the breast milk, which contains the secretory antibodies like immunoglobulin A. So these are the protection. This protection is very important, particularly during the infancy and in the early childhood, because you know that at that time the child has a reduced capacity to establish its own active response. Okay, the passive adaptive immunity has a very important advantage, that it has an immediate response. Okay, but again, this is important in the case of conditions like botulism and tetanus, that we can give the exotoxins, we can simply give the immunoglobulins to the patient, and the patient can be saved from the detrimental effects of botulism and tetanus. But again, this is an immediate response, yes. This is a preformed response, yes. This is but this is a short term response. You cannot create the immunity for longer terms. It can be established only for about few hours to few days to few weeks, but long term immunity is not with the passive adaptive immunity. This is with the active adaptive immunity. You know, adaptive immunity is established whenever there is an exposure to the organisms in the form of clinical infection, apparently in a microbe or any bacterium or any virus or any fungal pathogen comes into the body, manifests itself, body undergoes a full bloom infection, or there may be subclinical infection. Subclinical infection means that infection without symptoms, or the third possibility to develop an active adaptive immunity is to give the vaccine of that disease. So antibodies are formed against those invaders. Also the cell mediated immunity is evoked once the exposure has taken place, although the primary response is not preformed like passive one. It will take time, about 7 days, 10 days, even 21 days to fully established, but it will be a long term response. Okay, so antibodies, the form, they will be remaining in the body for long terms. So this is a secondary response, and the secondary, what happens at this primary response means that whenever the body is exposing the organisms for the first time, so it will take about 7 days, 10 days, even 21 days to establish the antibodies and cell mediated immune response. But once the body again gets infected by that invader, particular invader, it will take about only 3 days or even 5 days to establish the active adaptive immunity response. So overall, if we say that this is a progressing development of immunity, but it is for long term. Okay, another important role in our immune system is by obviously antibodies. The antibodies are the they have the fundamental role in protection against invaders, and they They have several variety of this by several variety of mechanisms, like they cause a neutralization of the toxins, they can cause a lysis of the bacteria, opsonization of the bacteria so that the phagocytosis process is enhanced, and also they interfere with attachment of the bacteria and viruses to the cell surface. So what happens, a normal level of immunoglobulin is about 1000 to 1500 milligram per deciliter, but if the level falls below 400 milligram per deciliter, the risk of infections, particularly with pyogenic infections, is increased. You know that um, antibodies, particularly when we talk about immunoglobulin G, they are detectable after few weeks of infection. So they do not have any role in fighting against a primary infection, usually at the site of infection, but they protect against the hematogenous spread, because hematogenous seedling is very detrimental to the body. So they are not giving the protection usually at the skin or the mucous membrane are giving, but against the hematogenous dissemination of the organisms, so that whenever there's a secondary infection, these antibodies are already formed, so they just get the signal and start exerting their protective mechanism. Okay, the cell mediated immunity, this protects against intracellular bacteria. Also, they have a very important role in killing the cells which are infected with viruses. The cell mediated immunity, you know that this is dependent upon the activation of macrophages, and you know that delayed hypersensitivity reaction, as I have told you, seen with the mycobacterium tuberculosis and histoplasma and coccidioides. So because they are mediating the delayed hypersensitivity type of reaction, means about several days to several weeks or even several months to develop. So there are certain conditions that predispose to infections in the organisms, and like immunocompromised states. There is a possibility that antibodies are low in number. The complement is low, like C3b, which is an opsonin. In those conditions, the pyogenic bacteria, they manifest their infections. Low complements like C6, C7, C8, C9, the infections of Neisseria meningitis are associated with this condition. In low neutrophil number, again, pyogenic bacteria. And low neutrophil function in chronic granulomatous diseases, we have Staphylococcus aureus, which is a pyogenic bacteria, and another type of fungus, which is Aspergillus fumigatus. Also, there are low CD4 cell count in AIDS, and in AIDS we have several type of bacteria which manifest, like mycobacteria, like cytomegaloviruses and other fungus also. Then the second possibility is because of the presence of foreign bodies, like the patient is having urinary catheter, IV catheter, maybe heart valves, maybe prosthetic joints, maybe vascular grafts. So with urinary catheters, the E. coli infections are commonly seen. IV catheters, as we have told you, that with Staphylococcus epidermidis, Staphylococcus aureus, and Candida albicans infection. With prostatic heart valves and prostatic joints, we have as epidermidis, and with vascular grafts, we can see the infections of S. epidermidis, Staphylococcus aureus, and Salmonella enterica.